Okay, we're gonna go ahead and scan the room to show our participants. Okay, thank you all for staying over this afternoon to listen to my speech. I'm DeMonica Cannon, and my speech will be on HIPAA privacy and guidelines. And we're just gonna go ahead and get started. In 2016, there were approximately 329 patient healthcare data breaches. Of those 329 breaches, approximately 16 million involved patient records. 43% of the personal healthcare information breaches were due to loss or stolen computers. And 40% were due to employee actions, and we'll discuss that a little bit in a few minutes. In our setting, we have the potential to also have data breaches. Can y'all think of any examples? That's okay, we'll get to it. So for this speech, as healthcare professionals, this is what we need to do. We are responsible for maintaining the privacy and personal health records of our patients. Those are some things that I just mentioned. Yes, I just mentioned that. There are 4 main points that I want to discuss in this brief speech, and the first one is the importance of data, privacy, and security. The second one is examples. The third one is how do we prevent breaches, and the fourth one is consequences of breaches. In 1996, the Health Insurance Portability and Accountability Act was established, and basically this act was established for patients to be able to easily transfer their insurance information from one insurance carrier to the other, and also their health records from one physician to the other easily. But with the evolution of technology and a lot of things been done electronically, the concern was privacy. How do we maintain the privacy of those records? So in 2003, the HIPAA privacy rule was established. In 2005, the HIPAA security rule was established, and that was mainly to come up with ways to protect the information. We had one way that was concerned with privacy, and then the other issue was security. So those 2 acts were put into place. Examples of data breaches. I told you we would get to that. An example would be stolen or lost computers. Did you all know that we have situations where laptops are stolen, and if you have patient information on that laptop, that's a potential for a breach. And the information is out there and for everyone to have access to. Another example is cyber attacks. Right now we have some local physicians that also have had the ransomware. Have you all heard of that? Ransomware, where their records are taken hostage and they have to pay a fine to either get it back. But yeah, that's a real, and that's nationwide, but I do know locally of 2 physicians who are going through that right now. Employee action. What are some ways that we potentially can have data breaches?
By leaving our computers on and information of the residents up on.
That's right. We have the EMR system here, and anytime we walk away, we should hit the hide button so that a person walking by cannot have access to the resident's information. We just recently, about a week and a half ago, started the kiosks, and that's for the CNA documentation. And supposedly that should have a timeout. That's another way. If we leave that information up, a visitor walks by, they can click on it and read another patient's information. Another example is improperly disposing of patient information or papers with patient information on it, or their name or their diagnosis. As an example, when we're doing a med pass, if we get through with the package that the medicine come in, we just don't throw that in the trash. We should throw it in the shred box. Or any type of paperwork that's a duplication, we don't put it in the trash, we put it in the shred box. And also texting patient information to the patient's cell phone or to the doctor's cell phone. Those are examples of the way that we, maybe unintentionally, can breach the data breaches. And discussing the information in areas like employee cafeteria, the hallways, the open areas, the open common areas, we shouldn't do that. How do we prevent data breaches? multiple levels of access control to specify who has access to the data. As an example, do you all think that someone in housekeeping will have access to a patient's medicines, their diagnosis? Because they don't take care of the patient in that instance. And dietary will have certain limits as far as their diagnosis and their medicines and things like that, but that's about it. So depending on the level of access that you need is what you will have. Another way, like I've already mentioned, was the automatic log-offs on the kiosks. In the EMR, we don't have automatic log-off, but we are able to hide it manually ourselves. And encryption of personal healthcare information. When the computers are stolen, if the information is encrypted, then no one can get to the information. But if it's not, then that's a potential for reach out. How to prevent data breaches. Only discuss personal healthcare information with appropriate staff and authorized locations. And that includes locations such as the nurse's station or a private room. Sometimes you may have to talk to a patient and they have a roommate, but the roommate is in the room, so maybe that patient and their family need to be taken to a private room. So you want to talk about things in a private room or in a nurse's station. You do not leave information out. If we're making copies for our reference, we don't leave that copy out. You want to maintain the privacy. Once you're done with it, like I said before, you want to go ahead and put it in a shred box. And you want to properly dispose of anything that's duplicated. Consequences of data breaches. Data breaches can cost healthcare providers anywhere from $500 to $1.5 million per violation. So if you have 30 violations and it's 500, you just multiply the 30 violations by $500, and that's just that's on the low end. Possible litigations, because the patients can sue us, or they can sue the facilities. And fraud is another consequence. And identity theft. If someone steals our information from, as an example, the insurance company, 2 years later they have stolen our identity, now we have credit card issues. So that's a consequence also of data breaches. As healthcare professionals, we are responsible for maintaining the privacy of our patients' personal health records. Who has $1.5 million? Anybody? So, in order to prevent breaches here in our facility, we just need to be more aware of the things that we need to keep in mind. And those points, again, were knowing the importance of the data privacy and security, examples of data breaches, and how to prevent data breaches, and the consequences of data breaches. So, if there aren't any questions, I want to thank you all for taking the time out for sitting in on this speech. Thank you.